Welcome to the National Fellow Online Lecture Series, sponsored by the Fellows Online Education Subcommittee, the Education Committee, and the Fellowship Committee. I'm just going to minimize this. There we go. So today we're going to do the National Fellows Online Lecture Series. We are really privileged to have Dr. George Chiampas here today. We've been trying to get him onto the online lecture series for a while now, and he's so busy. And we almost lost him, but we were able to get him tonight. He's coming in from Miami, where he's covering CONCACAF for which teams, Dr. Chiampas?
Well, here for MLS, covering CONCACAF meetings, and then whatever work is there right now. Miami is playing Nashville, so
So he is in the middle of everything. And so I bet he's getting texted all the time while he's talking, but I'm used to him doing 7 things at once. So the goals of this lecture series is an adjunct to the home program's educational content to provide fellows with direct access to educational experiences with AMSSM members and at times invited guest experts, and assist in the CAQ exam preparation. We want your input. So topics and speaker suggestions are very valuable and very important to us. Please go to the AMSSM.org website. You can click on under education. There's a tab for Fellows Online Lecture Series. The next slide has a QR code that you can scan. I'll leave that up for a moment. I'm going to move George's face for me. I don't know if you guys see that. So here's the Scan Me. Essentially, assist in the CAQ preparation. This particular lecture is actually valuable for attendings at all levels and all levels of experience, because while Dr. Chiampas is going to cover international travel, this has a lot of foundational management in team management. And as we know, Dr. Chiampas manages not just international travel, but mass events at the highest level. Please keep in mind the AMSSM Library of Sports Ultrasound Pathology. We're working on finding a collection of sports ultrasound pathologies. Any attending or trainee can submit cases with high quality images. Common or rare pathologies are welcome. We're still just building the library. The cases are published on the AMSSM website, and you can add these publications to your CV. Next week, tune in. The Pediatric Hip is Wednesday, March 25th at this time, 8:30 p.m. Eastern Standard Time. The speaker is Catherine Holnagel, and our moderator is Dr. Sherilyn DeStefano. Rules. As you join us, please mute your device's microphone and turn off your video. Submit questions through the chat function. I will be monitoring the chat function throughout this discussion. I will ask questions during the Q&A at the end, and please complete the evaluation at the end of this lecture. With that said, Dr. Chiampas, I'm going to stop sharing and hand it over to you.
awesome. Dr. Hrubes, first of all, thank you so much. Really an honor to be able to speak to all the fellows. I think that AMSSM and the work that has been done through AMSSM for our fellows and for all of our practitioners without question separates us around the world. And I'm very fortunate to be a part of AMSSM. Extremely blessed to be able to work side by side with some of the most amazing clinicians, people, and when I chose to go into sports medicine post my emergency medicine residency, I had no clue that I would have been in such amazing company. And so I hope that for those fellows that are actively working and it's late at night, just know that you've chosen an amazing path. And so with that, we're going to talk about sometimes some of the exciting things about being a clinician and being a sports medicine physician, and potentially some of the opportunities that may lie ahead for you. So this is gonna be really an interactive, hopefully, talk. It's one where I've just put some topics across some slides, hopefully to hit on some of the things that you may see in your CAQ, but also giving you the breadth of what you can expect going into sports medicine, and truly how the game and the sport has is transcended beyond our borders and is a global game. So I'm going to share a little bit about my path, just because I think it's important to historically know, who I am and how I got here. So I'm a DO. I trained and graduated in 1999 from Midwestern in Chicago. I did an ER residency at Cook County in 2003, 23 years ago. And what I could tell you 23 years ago, emergency medicine and sports medicine, there were not a lot of people that were doing ER in sports. And so because of that, even though I was extremely interested, I went in and became an ER attending in 2003. And then in 2005, one of my closest friends and colleagues, Dr. Carrie Jaworski, started a sports medicine fellowship at Resurrection. I was her first fellow. I took a chance. And from there, I went to Resurrection, stayed there, and then went to Northwestern, where I currently am at. My path is fairly unique, because there was no real direct roles for ER and sports medicine folks. I started taking on a lot of different volunteer opportunities, and has led to um, um, what is a really robust career. And again, very fortunate to be a part of it. So I serve as the chief medical officer for Major League Soccer. Formerly, I was at U.S. Soccer since 2006, and from 2014 until recently, I served as the chief medical officer for U.S. Soccer. I served for the last 18 years as the chief medical officer for Bank of America Chicago Marathon, Shamrock Shuffle, team physician with Chicago Blackhawks, Chicago Bears, and you could see some of the other things. I think it's important to know from an international perspective. I do sit on FIFA's medical committee, CONCACAF's medical committee, which really is kind of, as well as with the marathon, kind of shows you the depth and the global aspect. And I'm putting a couple elements up here, because when we think international, we obviously just came out of the Olympics in Milan, and the Paralympics that just finished. And it's important to highlight that it's both, athletes with abilities, athletes with disabilities. And so it's amazing from our perspective as sports medicine physicians how you can be a part of an international team, impacting not only players but the sport, and providing access to something that you care deeply about. Additionally, you see what's going on now from the NFL, which is expanding beyond the borders here in the United States, where they're traveling and playing in Mexico and playing in Europe, actually down in South America. And so, as you're watching some of these announcements, think about today's lecture, because when you hear the announcements of games like that, you should basically start thinking about all the things we're going to talk about today. So really the most important thing is your team. And putting together a medical team that is multidisciplinary, interdisciplinary, and touching on all the areas that are critically important is vital to your success. It's vital from a team physician perspective, or someone who's a medical director overseeing a group like that, that you've brought the skill sets. Two, that the egos are left at the door. Three, that you're a part of an amazing group and that there's open lines of communication, and that your goal and objective is to serve not only the athlete, but those that are a part of traveling in that group. These are just some examples from a U.S. soccer perspective, where we have athletic trainers, physical therapists, mental health or psychologists. We even have chaplains, and then a team physician. At US Soccer, anytime we send a team anywhere in the world, and mind you, at US Soccer, we have 27 teams, from youth teams to our players that are deaf or CP, to our senior national teams, we always send a physician. And it's either a primary care sports medicine physician, or it's an ortho physician with sports medicine fellowship trained. And so think about that team and how you're going to serve in this multidisciplinary environment. And what's important to understand is that you may be traveling for 10 days, 2 weeks, 4 weeks, 8 weeks. living with these individuals, having breakfast, eating, going to training in inclement weather, in different environments. And so your personality, your communication skills, your leadership skills are really important to be one, trusted by the player, trusted by the athlete, recognized for your clinical skill set, right? And your ability to deliver it with individuals you may have never even met before. And so those are all areas of context to think about this. Also, what's important is if you build a program like this, is how can you create continuity of care? Can you put a team of experts that are solely with that group so that over time these athletes are familiar with you? You create that athlete-patient relationship that is so critical and important. And so that leads to the processes, the policies, and the culture. Right? The culture is so critically important that we are seen by the athletes and seen by the organization as that safe place for the player, that safe place for them to come to get the highest level of care. And then the processes and the policies are critically important. Do you have a medical manual? What's in that medical manual? Are you addressing the environment that you're actually providing care with? Traveling abroad, all those things that we're going to talk about today. And then what are your processes? Imagine a player that is anywhere in the world and they bring up a situation. How does that get to you? How is the care at the site being managed? And then how can you from afar be able to assist them through any of those things? So here we go. Where are we going? Well, the Blackhawks just announced that they're going to be playing in December in Germany, right? So as soon as that happens, the organization, just like any organization, US Soccer, the NFL, teams from the NFL will be announced where they're going to be traveling. Immediately, that triggers a bunch of different things, right? It triggers the things we're going to talk about next. What's out there, right? We're going to Germany. How are we getting there? What's the environment like? What sort of personnel do they have? And your heart starts racing because now you're a fish out of water, right? We're so used to practicing in our environment, right? In our office, in our clinic space. Now, even a training room that you're familiar with, now you may be operating out of a hotel. You may be operating out of a banquet space. You may be operating, out of a training facility in the middle of a third world country. And so you have to be flexible. You have to be innovative while still managing to be delivering that standard of care that is here in the United States. And so you can see the complexities of that. So before you go, there's a lot of pre-planning, right? What's our pre-trip checklist? And so there's so many different elements from your admin folks, the folks that are basically determining what hotel you're going to stay at. What are your movements? How are you moving? What's the training schedule look like? And it's important that our medical team are sitting with them so that we're also aligned with what time are we training? What's the weather like? Is it hot? Is it humid? What are the necessary things we are doing to be able to make sure that as a collective whole, we're providing the type of care that is needed there. In addition, in that pre-planning checklist, you're going to determine a couple other things that we're going to talk about. But if you have any questions, by all means, you can put it in the chat, or you can also start speaking about it, or bring it to my attention through turning on your microphone. When you look at all this, the reason why I said that is put all these elements is because there are so many different standards globally. The American Heart Association versus the American College of Cardiology, European Society of Cardiology, IOC, USOP, PC, FIFA. And so when you work in this space, what you recognize is that all of us as clinicians at the end are trying to serve the athlete. And there's different consensus statements and different consensus guidelines around the world. But it's important that when you're traveling with a certain group or a sport, that you recognize under what umbrella it is. FIFA may have different standards. IOC may have different standards. So it's important to understand when you're traveling, what is that governing body that you're traveling under, and are you meeting those recommendations? Again, part of your checklist. you know what, we're going to be going to a different part of the world with a group of players that could be 16 years old, 17 years old. What are the challenges of having minors, right? Do you have emergency contact information? Have parents signed off for you to be able to take care of them? And then are you communicating with parents if something were to happen? What's your evacuation circumstance? And do you have insurance and those things? One of the main things are vaccines, right? And infectious disease areas. We'll touch on some of those. U.S. Soccer's traveled to India, third world countries like Guatemala. And so you immediately need to go on kind of the World Health Organization, CDC, and see what those requirements are for vaccinations and potentially put together a plan in place for those. And we'll touch on some examples of that we've had to deal with. And then lastly, who are your patients, right? These are all part of what you're thinking about. Is it the players? Is it the coaches? Is it the entire delegation, right? And did you put a plan, or did your medical staff and or athletic trainer, are you coordinating with them to make sure that the expectations are in place, right? Because when you go on a trip, everybody sees you as the doc, right? You're the doc. And so as the doc, you're going to get asked questions from everyone in that delegation. And you can imagine you have young athletes that potentially don't have significant medical problems, depending on the group, to older coaches and older staff that you may not know anything about them, and you're reacting rather than being prepared. And so just think about who your patients are, what their potential conditions are, and are you prepared to be able to manage it? In the picture in your upper right is actually one of our um, para teams from U.S. Soccer. So they could be individuals who have history of TBIs. They could be individuals who have seizure disorders. Are you prepared to handle that? The Chicago Bears traveling to London or to Madrid. What sort of needs do you have, and are you prepared for that? And then coordinating medical care. It is a without question, you are the facilitator. You're the glue. You're the person who, again, is making sure that when you're abroad, that you're the one coordinating this care, from acute responses to the most basic things, from mental health, from skin issues, from potentially musculoskeletal injuries or things that are associated with sport, to things that you've never even thought about. And so that's why, as a primary care sports medicine physician, your breadth of understanding kind of a little bit about a lot of different things is so important, because you are seen as the one who is basically providing the depth of care for this entire delegation. So it can be scary, it could be daunting, but you also want to be a part of a group that you have connections to, and that from top down, you know that there's someone that you can reach out to, or multiple people to support you at any notice. Okay. And so when you look for those opportunities, you never want to feel like you're on an island. So part of that pre-planning process is quite a bit, and things we talked about. Pre-planning with the team managers. What does the FIFA schedule look like in advance so that you can potentially plan? What's your global player pool? Are you aware of what all of those players have, right? Throughout the year, is the team and the medical team up to speed with, what issues they've had? So when you go into a camp, you're not shocked. You're not even notified of that. This player had a sprained ankle or is coming off this. This player has a history of anxiety, right? This player has had this issue. It is so important, as we talked about earlier, developing the trust, that you have some knowledge and some ability to basically speak to what that athlete potentially has. And then how are you flying there? Right? Is everyone meeting there? Are you meeting in one place, getting on a plane? And we'll talk about the challenges of that. And then, buses and travel and all those movements all play a factor into the environments that you're going into, especially long distance trips and environments. Food and water, right? Believe it or not, we're not in the United States, right? You may not be at a Four Seasons. You may not be at, a hotel that has certain standards. Are you in a place where, you essentially lose control of the kitchen? You don't know who's back preparing the food. It could actually be a group of people that actually want to impact your performance as a team. And those are realities in this space. And so how do you navigate that? So for example, fruit, for example, if you're traveling into certain parts of the world, are you are you using only peeled fruit, right? Where you grab it and you peel it and you only eat that. Are they washing it with clean water or not? Are you doing bottled water or are you using tap water? Hotels say it's all filtered. Is it or is it not? And so these are all things that you can imagine can have detrimental effects to your team and impact you. And for a trip, you're now managing, some horrific nausea, vomiting, diarrhea, and a negative outcome that could have been prevented, right? Additionally, with that, practicing good hygiene, right? Are you washing your hands? Are you bringing the hand sanitizer? We'll touch on some of that a little bit later as we talk about COVID and some of the navigation. Lastly, players love their snacks. Players love a lot of the things that they're used to. Are you bringing some of those things? Are you traveling with it? Things that are either supplements, nutritional elements, carbs, protein, powder. Can you get those into the country that you're going so that they have all the things that they need? And then your medical supplies. This is a very good picture of kind of how we travel from a medical perspective. Those trunks are called Zarges. In there could be all your modalities from what you need in a medical room, in a training room. You have your training tables, and then these all get delivered, dropped off in a hotel, and you are a part of the wider team that is setting up the training room, setting up the area for the players, and creating an environment that is conducive for you for the next 7, 10, 15 days. And there also could be movements. You're the person that's helping unload the truck. You're helping basically go to training, fill water bottles. That is your role as a part of being a part of this incredible group. And then lastly, you need to know what are the restrictions coming in this country. We'll touch on that with regards to medications, but it's important that you understand what can or cannot come in into the country. Also, what are some of the things as a physician that keep you up at night, right? Could a cardiac event happen? Do you have an AED? Where is it? Who has it? Have you put a plan in place? If you notice in the first picture I had, I was teaching CPR to our men's national team. I talked about creating a culture. It is now normal in our U.S. soccer space that our players actually get a CPR training video because and our coaches, because the expectation is that we're a part of a team. And so when you create a culture of that, you never feel like you're alone. Everyone understands that they play a role, and so that those little examples are ones that I hope that you take with you as you move forward in your career. But in this particular slide, as you think about it, where am I going? Azteca, which is at 7,500 feet, and you can see players potentially. Do we have oxygen? Are we going to deal with altitude issues? Is a tournament, are we going to be able to acclimate before we go or not? All things that you need to think about that ultimately may change what you put in your medication list. And there are a lot of different ways that sometimes we can navigate these things when you have plans in place. Also, you can see, and this is out of ESPN, how does the U.S. men's national team combat jet lag? There's different kits, supplements, sleep masks, glasses that they can wear at different times of night so that they can accommodate. Because in the soccer space, typically in the national team, what happens is the players play with their clubs and then they'll come and meet from their clubs to one location, everybody coming from a different part of the world. And so you can imagine you're navigating a lot of different sleep patterns, jet lag. And so having some processes and policies in place is also helpful. Additionally, in this world is doping matters. Many of these international tournaments do drug testing. And ultimately, the player is responsible, and this is a good question. The player and the athlete is responsible with what they consume. But as I shared earlier, right? As I shared earlier, you're seeing, are you bringing supplements from an organization. And if you are bringing supplements, make sure that they are either NSF approved, Informed Sport. Those are supplements that essentially are clean, meaning that they've gone through a lab process that has deemed those supplements to be clean for the athlete to take. And so it'll say NSF or Informed Sport. Um, Also have that conversation with the athletes in advance and educate them that you may be tested, whether it's pre-competition, you may get tested during competition, and you are held to this standard, whether it be WADA, whether it be FIFA, whether it be IOC. And so it's important that that educational piece is a part of this international travel, because it is real and can completely impact a player's career. Also, what are the risks? Where are you going? From a security perspective, from what sort of access you have to hospitals? What hospitals are they? How far are they? Have you put together a plan to be able to navigate this? If there is a disruption in the stadium, right? Is there a plan in place to seek shelter? A plan to get everybody safe? And are you able to manage any of those sort of things? And so these are additional elements that you have to think about, especially in certain parts of the world. And then something we talk about all the time is, do you have an emergency action plan, right? And imagine having these types of injuries somewhere in the world where you're not here in the United States, you don't have access to the things that you normally have access to, and how are you going to manage those things? And walk through some of those scenarios with your medical teams in advance, have EAPs in place. What hospital would we go to? This is our training center. This is where an ambulance would be able to come in. And then these are the relationships and the phone numbers of the people that can help us. And so the reality is all these things can happen anywhere in the world. And is your EMS system a real one? What's in that EMS system? Are they just drivers? Do they actually have paramedics? Or are you the one, and your team is the one that is going to have to navigate and manage these emergencies? So that's critically important on where you go. Establishing standards. We have come to a place where, from when I started to now, we are seeing greater and greater standards that are coming from a global perspective. And FIFA is just one example. I think the NFL is doing a really good job, and it actually is the relationships between these large organizations that are helping set these global standards. So example for FIFA, what you're seeing, and you can imagine from a FIFA perspective, where they have over 280 countries playing the same sport with a very tiered approach on the types of medical care, they're trying to establish standards. And so you can see from an emergency care manual to certain medical supplies and a bag that basically every country should have. And then they're also establishing some very clear emergency action plans. So for when those emergencies occur, how do you manage them? Who should be a part of it? And then also having trainings and simulations with them so that that standard is constantly being pushed. And so recognize that we are at a much better place now than we were 15, 20, 25 years ago. AMSSM, ACSM, IOC, USOPC, FIFA, NFL, all working together to establish these standards. And then really important, and I think something that is lost, and something, if you're a sports medicine fellow, it's all about relationships. It's about building trust. It's about having a network of clinicians around the world that allow you to be able to provide care for athletes no matter where they go. And those relationships are slowly being built out from the FIFA Medical Centers of Excellence, from London and the NFL, and identifying different clinics globally that athletes can get high standard of care, and recognize that when they come here, that same standard of care occurs, and when our athletes leave the United States, that same standard of care is met. So relationships are critical. We're going to walk through a couple little scenarios just to show you, how real this can be. in the Women's World Cup, or in the Olympics, I should say, in Brazil. For those, maybe you're a little bit young, but Zika became the reality of those Olympics. And it was a very controversial topic. Zika was one that impacted women, or women that were potentially going to get pregnant. And with our women's national team from US Soccer traveling to Brazil, there was not the greatest guidance at that time from the Olympic Committee with regards to real information for our athletes to go to Brazil. And when there's a lack of communication, when there's lack of guidance, which as a federation, you rely on sometimes these large organizations to be able to guide you, you have to be able to guide your own team and players. And so at US Soccer, what we did was we immediately lifted an infectious disease doc, immediately brought in OBGYN, tied in our national resources, and put together a webinar and a seminar and brought those experts to our women's national team ahead of what the USOPC or the Olympics did, so that we can answer those questions, right, as best as we can with the information that we had at that time. And that's really important in the international space, is you rely on sometimes on those large organizations to be able to guide you, but sometimes they may not even have that information. And it's important for you to bring those resources together to be able to, again, educate your athletes, even if it's with information that is still not determined, but being able to communicate to them what is currently happening, and being able to answer those questions and continue to answer those questions to make sure that they feel safe going to this event or not, because they look to you as that expert. And so sometimes you have to bring in other experts, leaders to support you with that. COVID. Another example from a global game, how this impacted the world. Obviously, the initial piece was, let's protect everybody, let's get everybody home and stay safe. But coming out of COVID, it was amazing the steps, and I believe that sports from MLS at that time under Dr. Patukian, from NFL, from Major League Baseball, NWSL, really showed kind of how you can put together processes, contingencies, and a layered approach, a layered mitigated approach to basically keep people safe. And so, for example, at US Soccer, what happened is we had players test at home or test with their club multiple times, right? That they had negative, negative, negative. And then they were able to get on a plane, come into our hotel environment, get tested, go straight to their room, right? Make sure that that test is negative. For the first 24 to 48 hours, we had spacing, right? And we would test again, right? And so you can see that when we tested in advance multiple times, we probably dropped a positivity rate to under 3-4%. When we got them at the hotel, we again tested them to bring that down even to a lower amount. Keep them all separated so that we can move forward with a 10, 12-day camp in a safe way. And so sport really learned how to pivot with COVID. And I think those are just some examples of the challenges that exist in the global international sport. And I think sport back then did an amazing job. I'm also going to share this story, and then in the Q&A, I hope everyone can, share their thoughts. Tristan Torbett, who's given me permission to speak, and his story is on ESPN, is one of our US Soccer deaf players. First of all, an amazing, amazing young individual, and a very close friend, him and his family. We talked about processes, we talked about having medical staff, and we talked about having a culture. Tristan was in Asia with our team, with our staff, and he had a catastrophic injury where he had an ischemic stroke with our team. Our athletic trainer recognized it, brought it to the attention to the physician that was on staff. They immediately recognized that he had an acute emergency. They actually um, got them to a major city, uh, and they were able to actually thrombolyse and stent this clot, which saved his life. Um, I'm actually sharing probably just a small piece of that. Um, but it was because of the systems and the processes that we had in place, which allows him to be in that lower picture, meeting his hero in Christian Pulisic, who they've even created a stronger bond. And it shows you the impact that you can have. And again, in a young individual that you would never expect this to happen, um, how important our medical teams are around the world. So you could look up his story. It was written, and it's an amazing story. So we're going to kind of end on a couple last things. FIFA and the World Cup is going to be coming here to the United States. We talked about relationships, and you can imagine 48 teams from around the world coming to the United States, Mexico, and Canada. My role is going to be as FIFA match doctor, at Levi Stadium in San Francisco, which means every game that is played there and both clubs, both teams, I am the bridge for them being able to have the medical care on the pitch, concussion standards and best care, assure if there's any acute emergencies, head injuries, spine board, transportations to hospitals, any of those circumstances that I make sure that those FIFA standards that I shared with you are met. And as you can imagine, when billions of people are watching that sport, that is why FIFA has done such a significant amount of work to make sure that those standards are met. So one, most importantly, the players get the care that they should. And secondly, when 48 teams from around the world come, that standard is the same for every team. And so that is my role, and then replicate that across countless cities. As you can imagine, that role can be challenging. You have teams that may or may not speak the language. You may have physicians and medical staff that may practice differently, and their understanding of what U.S. laws are, understanding that we operate in a very different EMS system, and so you essentially become truly the conduit, but the person who is actually making sure that you're being not necessarily thrusting, hey, I'm the physician, I'm in charge, but making sure that we are operating as a single team and recognizing if something happens with one team, we're all going to support that team, and if something happens with another team, we're all there for the same purpose. And that's quite honestly what medicine and healthcare is, and this is a great example of how we do that. So you can imagine, from heat, from environmental issues, and all the things that can happen in this World Cup, that's what's facing us in the next 3 to 4 months. Your role as a team physician is, honestly, it's about being a part of the group, but being a part of the group in a very professional way, and it's a fine line, and it's one that I don't think anyone teaches you in medical school. It doesn't teach you in your fellowship about maintaining privacy of those players, maintaining a level of respect, providing a high level of clinical care, but also being, a great teammate and a great team member. Someone who is not above anyone else, someone who can work equally across disciplines. And I think when you operate in that capacity, it is valued, is appreciated, and it goes a long, long way. And so it is really important that is that you understand that team physician role, because it's one that is critically, you're fortunate and blessed to be able to be in that. So with that, I'm going to open up to questions. Melody, hopefully this brings a little bit of some highlight on some of the nuances of traveling internationally, and hopefully it can spur some questions.
Yeah, that was amazing. Thanks so much, George. I wonder if you might, since we have a minute for dialogue and chatting, if you might stop sharing your screen. We've got over 20 people on, and most people are they have their pictures off, but Sedge had asked a question specifically. First off, he said you gave a fantastic talk. Um, Sedge, are you able to unmute? I'm happy to just have you ask your question.
Yes, just forgive my sunburned face. I am working with the Orioles today down in Florida, so I don't have the ability to be tan. George, phenomenal talk. Thanks so much for giving it. I was hoping maybe you could talk to if you're traveling, but maybe not with your athletes. Maybe you're going to travel and you're covering an international event where it's people you don't know as well. Are there universal aspects of the pre-participation exam, and how do you approach those situations? Thanks.
First of all, Matt, really good to see you. I would say go Orioles, but I'm a Cubs fan, and I'll be a Sox fan now just because you're an Orioles fan. Um, um, I think it's a great question. I think in that particular case, some examples of that could be is when you're selected as a physician, let's say in an Olympics, and you don't know the players that are coming, right? I think that's a good example of that, Matt. I think it's important as best possible to, if there is an entity that knows who the players are coming, that can you rapidly get an intake sheet. If it's a group of players, can there be an intake sheet so that you at least understand what you're dealing with? And then secondly, I think it's valuable that look, when you work in the emergency department, you don't know what anyone is, right? And so you just have to be prepared, and it's similar in that context. But where you can do some work in advance, I think it's valuable to be able to do that. Another thing may be you travel in a marathon, right? Or a large event where you're providing care for individuals, having quick algorithms, right? And understand what you're looking for that event, and what potentially are the medical presentations that are tied to those events are also, really, really valuable to help you navigate some of those acute issues and emergencies.
Thank you.
Thanks, Sedge. Also, I like the flex that you're in Miami when it's like 30 degrees in New York City, but fine.
All right, I was in New York last week. It was rainy.
Yes, it's can't rain. It's too cold right now. We actually had another question come in from in terms of international travel. Any examples where you would have done something different or where reaching out ahead of time really helped you?
Melody, you froze for a second. Can you repeat that?
Oh, yes, sorry about that. So I'm going to start with a thanks, George. Awesome. Just to make sure you caught that from Margot Patukian.
Margo, no
Margot,
problem.
since I froze, do you want to ask your question?
Uh, no, you that's fine. You had it. It was just, I think there are a lot of examples where, you might have done something different and or where reaching out ahead of time might have helped you.
First of all, for everybody on this call, Dr. Patugian is the GOAT. So I want to just first say that. Um, I think Margot, you know what? I think the thing that I would probably try to emphasize, sometimes as physicians, you don't want to overstep. And if there's a system in place, for example, when I would travel, we really wouldn't ask like the coaches or get any information on the delegation that was traveling. And it was just that was the culture. And as a physician, you want to tread lightly, but at the same time, it's okay. And actually, if I could go back, I would have probably done that more. I would have made sure that early on in my career, knowing what was right and knowing what was important for the entire delegation, is put together even an intake form for them. And I
Yeah.
think they appreciate it. I think the coaches appreciate it, the staff members appreciate it. And I learned that later in my career. Again, not being a bully, not trying to, overstep, but making sure that as a comprehensive group, we're caring for everybody, and not just physically, right? Emotionally, mentally. We're at a place now where we talk about, the mental health of our staff. You're traveling and you're sleeping at 1 in the morning and you're turning around and it's multiple days. those are normal conversations. And as a physician and as someone who's doing that, it's okay to have those conversations. I think those are probably some of the things, if I could go back, I would have probably tried to implement sooner.
Yeah, I think that's a great point. Yeah,
Um,
thanks.
Thanks for asking. Thanks, Margot. Samantha Mazzeo asked a great question. I don't know if she's able to unmute, but I'm happy to just um, do it. I'll ask it. Again, fantastic talk, Dr. Chiampas. Any advice on carrying controlled substances to other countries? Is there a resource out there to guide us on what medications we may or may not be able to bring into other countries, i.e. narcotics? Outside of controlled substances, are there any other medications that could be flagged in an international space? And I think we can lead you in with, especially when we travel for World Cup, some things that are just over the counter here are simply not allowed, like in India or something. So I'm sure you encounter that on a monthly basis.
Yeah, so first of all, Samantha, good luck in your career. Thanks for the question. I would say that typically what happens is if it's an organized tournament, they work with the government to share with you what medications can or cannot come into the country. Let's start there. Um, Otherwise, I would recommend never traveling with controlled substances and having alternatives in regards to pain management or any of those other things. One example is in the sleep space. When I came in, completely removed any of those prescription sleep medications, um, um, and went to melatonin and natural elements to be able to manage sleep. Now, what you'll do as a team physician, there may be players or athletes or staff that have medications that you'll have their physician write their prescription and then they travel with it and it's theirs. You're not disseminating it, you're not doing it. So again, in advance, having those conversations, seizure medications, potentially benzodiazepines, if they're taking it as a part of their life, those should all be written in advance by their docs and they're traveling with it individually. Hopefully that answers your question.
Yeah, that was great. Thank you.
And how do we say your last name?
Mazio.
Mazio.
And
Just a
Sam is
little, a
fine.
little
That's
Italian.
super
A little bit.
Chicago.
Tiny bit.
There was a great question. Is Brendan George on? Do you want to unmute and ask your malpractice question? Otherwise, I'm happy to read it.
Yeah. So I just had a question about what the different malpractice insurances look like in your roles and kind of how to navigate that. I tried to find some for an international kind of a spontaneous trip internationally. I just couldn't do it because I couldn't find kind of personal coverage. So
Brendan, it's a outstanding question, and I wish, and everyone probably on this panel from Dr. Sedgley and Patukian and Thacker and Melody, I think we're all scratching our heads sometimes. However, when you're like U.S. Soccer, for example, has retained a policy that covers the physicians. And so if you have those opportunities, you should ask those questions. Am I covered? What is the coverage? And if you don't have it, you should feel uncomfortable providing that. And that's just the reality of it. If you're traveling with the large organizations that I just shared, typically that coverage is there. It's interesting, even in the NFL's perspective, when the physicians are traveling, the US physicians are traveling to London, they're using resources there to help provide care, meaning like if they need to do something, they're leaning on the relationships that they have there that are actually licensed in that country. So just gives you an idea of kind of the challenges, when you travel abroad.
thanks. I appreciate that.
Thanks, Brendan. And then Dr. Thacker, the team physician coordinator for our U20s and 23s on the call here, has a question for you, Dr. Chiampas. I'm sure it's going to be very hard to
Yeah.
so get ready.
Oh, a mild correction. Margot now has the 23s. But
20s.
yeah, 20s, 18s, 19s. So kind of to dovetail on Brennan's question, but also in the reverse, right? So we now have, in your new role with MLS and with kind of as the FIFA coordinator for these stadiums, when we have all these international physicians coming in, what are what are our protocols and what are they afforded as far as the ability to take care of their own athletes? I mean, do we have like a special dispensation or license, for them to do that? Similar to like, how we have when we go across state lines with our teams. Is that something that would be in effect for them, or do we need to pair them with a physician at at each of those sites to make sure that things happen, in our system? I mean, how is that going to work?
So for that's a scenario. And first of all, Poonam, great to see you and hope the little one's doing well. Um, um, there's a lot of elements that are put together for the World Cup, and for the fellows to understand, I'm a FIFA match doctor, which means basically for the game, I am the facilitator between EMS, the hospitals. If an emergency were to happen on the field, I'm essentially in my role, just like the others in that role, are basically the coordinators of care in San Francisco. Now, mind you, I'm not licensed in California. So the EMS, and so those will be very clear roles there. EMS, and then there's a local venue medical director that is also part of that group that is there to facilitate care at the local facilities, clinics, MRIs, and managing that care. So you can understand that there's quite a few elements there to meet those standards, but also to provide care. In reality, when that team goes to their hotel and their physician is with them, athletic training stuff like taping and all those elements, there's probably some understanding from the federal government that that is occurring. But during the matches and during the acute circumstances is why you have so many different local clinicians, local EMS, and then a coordinator to be able to provide care to address some of those things that you just brought up.
Thanks, George.
Thanks,
Yeah.
George.
Yeah, I will also add, sorry to interject here, but I'm the venue medical officer for Philadelphia, and I would just say that in addition to what George just mentioned, we had literally had to change the legislation in Pennsylvania in order to allow our FIFA match doctor from Glasgow privileges or sort of having the opportunity to, work on the field of play. He doesn't have hospital privileges, and neither do any of the doctors that are coming from other countries. But we had to change the legislation to allow the Licensure Clarity Act to extend to countries, and that allowed then the doctors from all these different countries to be able to take care of their teams.
That's exactly the answer I was looking for. Thanks, Marco.
Yeah, and keep in mind, some of the people on this call had to advocate for us to be able to travel with our teams to other states, right? Like how sports medicine started and where we are now is pretty amazing. Actually, George, there was a question about different licensures. So they mentioned MD versus DO and confusion about that. Also, as we know, in Europe, they don't have MD DOs. And so have you encountered any confusion with that, especially with the different labels for the medical people?
I've never experienced any confusion with that, or that's never been, I don't think anyone even I'm associated with has ever had that issue. Obviously, if you're going there to stay and permanently try to train there, that's a different scenario. But if you're traveling from the US with a team or from a sport, that's never been a challenge or a setback.
And if anybody would have encountered I mean, you've been traveling for how many decades, so certainly it's good to hear that that hasn't been an issue.
What I would say is on the reverse side, and I think what we're experiencing because the games are becoming global is that we're seeing a lot of, physical therapists, physios, different specialists that have trained elsewhere in the world. And as our games are becoming more and more global, individuals are trying to come to the United States that are not licensed in the United States that are trying to get jobs with professional teams, organizations. And that is, I think, the next challenge that we're going to see, quite honestly. We've answered a lot of the things to your point, Melody, and to Dr. Patukian and Poonam, where we've been able to kind of facilitate some of those things. I think the next challenge is the wave of clinicians from around the world wanting to practice here in the United States.
Yeah, that's a great point. And I want to give, we have just a few more minutes. I want to give the mic to Maria Bianchi Ray. She is on every single Fellows Online Education Series talk. She's always listening in. Maria, did you want to ask your question or do you want me to read it out loud?
Yeah, so I'm just wondering, how does it work if things like something happens, like chaotic, and you need to coordinate like medical care for an athlete with medical personnel in a different country with a language that is not English? Like, how does that work in the moment? Do you have interpreters that travel with a team, or like how do you communicate with people in the country?
Yeah, and that's a great question. A lot of times, again, if it's an organized circumstance, they'll have what they call a TLO, or so they'll have someone who's from the local organizing side that speaks the language and is your liaison. Obviously, in a medical scenario, it's challenging. And so it's important when you do your EAPs and your emergency action plans or before a match that you've had those conversations, right, with the paramedics. Sometimes you have you'll have signs, and so you can have hand signals. And so you've had that conversation in advance to make sure that you're on the same page. And even in the biggest of games, right? Even in big World Cups, you will have sometimes those language barriers, and so you'll use multiple mechanisms to be able to have the ability to provide the care. So whether it's a signal over your head, whether it's wave people on the field. And so I think those are just a few of the examples, Maria, that are used in sport that bridge us globally in getting the care to athletes.
Well, on that note, I think that's a great last question. George, we really appreciate your time. Dr. Chiampas, this was, I know, something that you live all the time, every day, but for those of us who have the opportunity to learn from you regularly, we wanted to share it with people who maybe don't get to see you all the time. But for the benefit of AMSSM, a lot of the people on this call are going to be in Seattle, and there will be a soccer lecture, an ICL that Margot and Poonam are putting together that George and I get to hang out with them too. So keep an eye on that. It'd be great to see your faces in person.
And if I could just say one last thing to the fellows, thanks for taking time tonight. We really are a special family, and I hope you have an amazing career. Hope to see you all in Seattle, and really fortunate and blessed to be a part of this. So everybody have a safe night, good night, and hopefully you have an amazing, amazing future, each of you, and you love the career path that you've chosen.